Dementia runs in my family. What can I actually do? If dementia runs in your family, you may have wondered, is my future already decided? And if it isn't, what can I actually do? Family history and genetics matter as well as age, and there are risk factors we cannot change. That is not the whole story. I'm Dr. Mamata Majmundar. I'm a dual board certified family physician, and I'm also a daughter. And when I look at what we know about dementia risk, there are also things we can influence. A new study published in Neurology gives us a striking example. Researchers followed more than 12,000 people in the United States for more than 2 decades. They looked at 3 vascular risk factors in midlife: high blood pressure, diabetes, and smoking. Starting at age 55, people who had none of those 3 risk factors averaged about 30 additional years alive without dementia. 30. People who had all averaged about 17 and a half years alive without dementia. That's a difference of nearly 13 years. Now, I want to be careful with that number. This was an observational study. It does not prove that if you lower your blood pressure, prevent diabetes, or stop smoking, you personally gain 13 dementia-free years. And the people with more vascular risk were also more likely to die before developing dementia, which is important when interpreting these numbers. I would not turn this study into a promise. What I would take from it is this: the health of our blood vessels in midlife appears to be closely connected with how many years we live without dementia. And some of the risk factors involved are things we can do something about. That gives us somewhere to start. Family history can also raise another question: should I get genetic testing? I have often thought about this personally. If a parent had dementia, would I want genetic testing simply to know whether I was at higher risk? It's an individual decision for everyone. For me, the answer would probably be no. And the reason is fairly simple. Right now, knowing that information would not change what I am doing. That is my personal decision. It is not advice for someone else. There are circumstances where genetic testing can be appropriate. And if you're considering it, that may be a conversation to have with your physician and your genetic counselor. One question I think is especially useful is, what would this test tell me? And would the result change what I do? Because my own focus is on the things I can influence. And this goes beyond those 3 vascular risk factors. A separate body of evidence in the 2024 Lancet Commission on Dementia identified 14 potential modifiable risk factors across the course of our lives. These include things such as high blood pressure, high cholesterol, diabetes, smoking, physical inactivity, hearing loss, vision loss, depression, and social isolation. When I hear 14 risk factors, I think about opportunities. Here are 14 more things you need to do. I hear you do not need to tackle out 14. You don't need to redesign your life this week. A better place to begin is simply to know where you stand. Do you know your blood pressure? Do you know what your blood sugar is and where you are if you have diabetes? If you smoked, have you talked with someone about support for quitting? Is there a hearing problem you have been putting off? What about vision? Are you moving your body regularly? Are you connecting to other people? You're not looking for perfection. You're looking for the places where your health gives you an opportunity to act. And if you're not sure where to start, take that question to your next healthcare visit. What risk factors do I have that we can actually work on? Then choose one. Maybe your next step is finally checking your blood pressure. Maybe it's getting your hearing tested. Maybe it's making an appointment for your vision. Maybe it's talking with your healthcare team about diabetes, cholesterol, or smoking. And maybe it's becoming a little more physically active, taking a few more steps every day. And maybe it's just reconnecting with the people around you. The point is not to do everything. The point is to identify something that applies to you and take the next useful step, something that you believe that you can do and move forward. And I want to make one point, especially for anyone watching this who is older. If you're 70, 75, or 80, please do not hear a discussion about midlife risk and think, I missed my chance. You did not. Dementia risk develops across a lifetime. Some opportunities begin earlier, others remain relevant later in life. You start where you are. So if dementia runs in your family, yes, family history is worth knowing. Genetics are worth understanding, and there are parts of this we cannot control. There are also things we can influence. You do not have to solve all of them today. Know where you stand, ask which risks apply to you, choose one thing you can work on, because family history is important information. It is not an instruction for how your story has to end. Start with what you can influence today.